I go on every day like nothing's wrong. But in actuality, I'm sick.
Bonnie is my salvation. Bonnie is my caregiver. Otherwise, I would be in a nursing home. I'm worried about what would happen to your boys if you're not here.
I was sick Tuesday, throwing up blood here. Miss Vicky said, Bonnie, go to the nursing room. First thing come to my mind is I can't afford it.
Nearly a quarter of households in America struggle to pay their medical bills, regardless of whether they have insurance to help. In places like Tennessee, when people can't afford to get care, often they don't. And in poor rural communities, the financial burden gets placed on the hospitals. Hospitals like Gibson General Hospital in Trenton.
In Trenton, Gibson General used to be a full-service hospital, and ultimately we just had to shut it down.
With 10 hospitals shuttered in recent years, and more than 24 at risk, Tennessee has the highest per capita rate of hospital closures in the country.
And most recently, the one that's in the process now is Decatur County. What happens when patients with insurance go elsewhere is that a rural hospital is left with a large amount of uninsured and people with emergency conditions who may not be able to pay their bill. It doesn't take a healthcare finance person to figure out that that's not sustainable. Probably the hardest part of closing a rural hospital is that we know it affects patient outcomes. And people ask me, will people die? And the answer is yes. It really is a charge for all of us to come up with innovative ways to address this issue because it's a problem all across America because we haven't gotten it figured out yet.
States that expanded Medicaid under the Affordable Care Act have seen fewer hospital closures. But Tennessee, which in recent years has cut Medicaid enrollments to balance the state budget, opted not to.
We can't afford to give just free health care to everybody. The state would go bankrupt. We would have to cut services everywhere else.
Bonnie's $30,000 annual income disqualifies her for Medicaid in Tennessee.
My employer offers me health insurance, but I can't afford it. We're talking $254 a pay period. I had a stroke July of 2015. I haven't been taking my blood pressure medicine and my nerve pain medicine. I definitely am afraid. What's going to happen is I'm going to end up having a major stroke. I have to weigh my options. Feed my kids, go to the doctor. Feed my kids outweighs me going to the doctor and me knowing that I'm sick.